Welcome. My name is Emily Blum. Please enjoy this presentation summarizing my Eastern Washington University Master of Public Health Applied Practice experience with SIGA Technologies. The experience was focused on an mpox patient's journey in the United States. The purpose of the APE was to gain experience working in the infectious disease space from the lens of a pharmaceutical company, which targets antiviral therapies for viral diseases such as mpox, formerly known as monkeypox. Specifically, focus was intended to follow the ongoing 2022 global mpox outbreak, evaluate the epidemiology of the current mpox emergency in the United States, and provide details on exposure, evaluation through systematic review, risk assessment via exposures, and public health impact. Additionally, the goal of the AP was to develop a transferable population-based program in the interest of future mpox or related orthopox virus emergency preparedness and responses, such as a smallpox outbreak. I perform my APE with SIGA Technologies. SIGA is a public commercial stage pharmaceutical company focused on providing solutions for unmet needs in the health security spectrum, as well as emerging infectious diseases. The company is headquartered in New York City with research and development facilities in Corvallis, Oregon. My mentor was Dr. Dennis Hubrey. Dr. Hubrey is SIGA's Chief Scientific Officer. He is a distinguished scientist with more than 25 years of experience in pox viruses, virology, and anti-infective research. He has published more than 210 manuscripts, 400 abstracts, and currently holds approximately 200 US and international patents. As the student, Emily Blum, I am a clinical research professional with 20 years of experience in the field, including expertise in clinical trials and regulatory affairs. I strive to support global public health with the advancement of therapeutics and improved patient outcomes. For my work products, major work product number 1 is an epidemiologic assessment of mpox designed to evaluate the epidemiology of the current mpox emergency with focus on disease clade 2 in the United States. The assessment provides a historical review of the mpox outbreak with details on the virus, transmission, the epidemiological indicators, such as factors within the social cognitive theory. The assessment also provides detail on diagnosis, diagnostic tools with known challenges and potential solutions, disease case counts and case criteria, and the burden of disease. Disease exposure evaluation through systematic review of distribution of cases and detection offers insights into transmission routes. A summary on exposures and populations of interest, such as those living with immunocompromise, along with a final risk assessment and public health impact are included. Finally, vaccination, immunity, and future threats are considered. Data includes mpox case information from the mpox emergency since 2022 and is inclusive of trends and demographics. For major work product number 2, it is a population-based mpox preparedness and response program, which is created to be used as a guide to help improve response to future mpox emergencies. The program was developed also as a transferable population-based program that includes recommendations and solutions to operate more equitably, effectively, efficiently, and with more transparency in the interest of future mpox or related orthopox virus emergency responses, such as smallpox. The goal of the program was to understand and document successful practices and enabling factors to better allocate and deploy medical countermeasures to support reduced mpox burden of disease. The program includes priorities for access among a diverse patient population, including racial and ethnic minorities and those living with HIV, who are currently experiencing a higher incidence of mpox infection. Cultural competencies also play a crucial role, which were addressed. The program is inclusive of major triggers and ways in which response varies to each trigger. The program is concluded with a summary of implementation challenges and opportunities, followed by a summary of post-response evaluation components and details to support creation of an after-action report. Minor work product number 1 is a patient journey map that was created to help assess the current mpox patient journey, beginning when a patient first develops a need for care. The patient journey encompasses all touch points of a patient's experience. It ensures the evaluation of social determinants of health, are considered as influencing factors to patient care outcomes. The journey also includes barriers and challenges towards the access and allocation of medical countermeasures during the Mpox outbreak. Minor work product number 2 is a patient access infographic, which I created to outline the various methods for patient access to Mpox therapies in the United States. This infographic is inclusive of treatment inclusion and exclusion criteria and is designed to be a companion tool to the patient journey map. In activities completed for the APE, inputs included information and support from a variety of stakeholders, including the Centers for Disease Control and Prevention, the CDC, Poxvirus and Rabies Branch, the CDC Office of Readiness and Response, National Institute of Health or NIH, and NIAID Mpox clinical research teams, local and state health departments, SIGA Chief Executive Officer, SIGA Scientific Officer, SIGA Medical Officer, SIGA Financial Officer, and SIGA's Medical Affairs Project Coordinator. Inputs included resources from CDC Mpox data, CDC morbidity or mortality weekly report publications, NIH and NIAID Mpox clinical data, World Health Organization Mpox case data, and Pan American Health Organization case data. Input supervision came in the form of mentorship provided by SIGA CSO and CMO, including review of my implementation plan and review of work products. Mentorship was also provided from Eastern Washington University professors, with particular attention to fulfillment of the Council of Education for Public Health CEPH competencies. Activities started with brainstorming of ideas surrounding the Mpox outbreak, which emerged in 2022 rapidly, and since its emergence, my goal has been to create tools to support improved response to ongoing and future outbreaks. Brainstorming activities also included review of opportunities for increased patient medical countermeasure access and improvements to public disease education, among others. Brainstorming was ever evolving as the current outbreak remains ongoing. Planning activities took a holistic view to an infectious disease outbreak such as Mpox. I plan to identify needs and activities that could help improve responses both now and in the future. The planning stage involved review of the CEPH competencies and development of the best avenues for competency implementation. Research activities had focused primarily on qualitative research that was seeking to interpret data within a real-world context of an outbreak through observational data, although some research was quantitative and that it looked to interpret a causation or correlation between variables, such as HIV and Mpox co-infection. Data collection activities were both quantitative and qualitative, focusing on secondary and tertiary sources, which included local, state, and county level case data, peer-reviewed research, secondary data sets, and secondary findings. Meeting activities involve consulting with various providers, health departments, and health agencies to discuss Mpox disease and medical countermeasure education. I also met with various internal company stakeholders to outline development of the various deliverables, their implementation, and their challenges. Outputs including meeting agendas, summaries, and minutes, project outlines, brainstorming notes, raw data, data sharing amongst stakeholders, educational materials, and final major and minor work products. Anticipated outcomes included expectations that I would take the inputs and activities performed to implement a well-rounded Mpox preparedness and response plan, along with a thorough epidemiologic report on Mpox. Through mentorship, these activities were developed to be supportive of future outbreak needs. Development was consistent to focus on evidence-based approach to fulfilling goals for increased Mpox preparedness, response, and disease epidemiological understanding. End products were implemented in outlined form and modified to additionally include a patient journey map and a patient treatment access infographic to help fill the gaps in information and support the major work products more robustly. The competencies were modified throughout the APE based on progress, competency guidance, and through instructor mentorship. The evaluation process was ongoing through self-review of actionable goals and through professor and mentor final evaluation of the draft portfolio. For the competency connection, CEPH number 1 is the application of epidemiological methods to the breadth of settings and situation in public health practice. The work product created is an epidemiologic assessment of Mpox. The assessment evidence is inclusive of details on exposure, evaluation through systematic review, and risk assessment via exposures. It is also inclusive of the threat to public health and impact. CEPH number 4 is the ability to interpret results of data analysis for public health research, policy, or practice. The work product is the epidemiologic assessment of MPOX. The evidence assesses the MPOX emergency, global case data, and mortality data. It also includes details on trends and demographics, which draw linkages to disparities, which may influence future response efforts. CEPH number 6 requires discussing the means by which structural bias, social inequities, and racism undermine health and create challenges to achieving health equity at organizational, community, and societal levels. I create a population-based preparedness and response program as evidence to help guide response to future MPOX emergencies. The program is designed to aid in the understanding of successful practices that enable improved care allocation and deployment of medical countermeasures to support reduced MPOX burden of disease. The program includes priorities for access among a diverse patient population. Attention has been made to racial and ethnic minorities and cultural competencies, such as the HIV community, as these populations are currently experiencing a higher incidence of MPOX infection. The current outbreak highlights the need for agencies to respond to emergencies with greater focus on the inequities that influence populations for special consideration. CEPH number 9 is the design of a population-based policy, program, project, or intervention. I created a policy-based preparedness and response program to help guide response to future MPOX emergencies based on postulated triggering events. The development of the program was designed to include recommendations and solutions to operate more equitably, effectively, and efficiently. Need for more transparency in the interest of future MPOX or related orthopoxvirus emergency response, such as smallpox, has been highlighted. Ways in which the program can support preparedness is a major path forward towards successful downstream implementation. The program also includes a section on potential challenges and opportunities and concludes with a post-response evaluation component and criteria to include within an after-action report. CEPH number 22 includes comparison of the organization, structure, and function of healthcare, public health, and regulatory systems across national and international settings. I created 2 minor work products as evidence. The patient journey map provides an overview to access the medical countermeasures, initial point of care, treatment disparities, determinants of access, and insurance considerations. The map ensures evaluation of social determinants of health are considered as influencing factors to patient care outcomes. The journey also reviews the barriers and challenges towards the access and allocation of medical countermeasures during the MPOX outbreak. The treatment access infographic outlines current care practices with treatment inclusion and exclusion criteria, which notes limitations to access and is to be used as a companion to the map. I had a variety of key takeaways from the applied practice experience. Through activities such as research and communication with relevant public health stakeholders, I concluded that there are many barriers to equitable health care that impact an MPOX patient. However, these barriers to care are not specific to MPOX or other infectious diseases, as they are exacerbated by our built environment and societal inequities for racial, ethnic, and cultural groups. I was able to recognize that the work products I created added value to my professional and personal growth. Notably, I learned the importance of flexibility, perseverance, and creativity while working in a real-world environment. I also concluded that by putting my professional, educational, and personal activities in silos, I was creating barriers to my overall growth. I had many positive experiences during my applied practice experience, including constructive opportunities for collaboration, engagement, and communication with those working in the field of public health. Looking back, the applied practice experience afforded me with much more than a straightforward learning opportunity in the field of public health. The experience opened doors for me to step into the world of public health and recognize the field's vastness. I was afforded the ability to see firsthand how welcoming public health professionals can be with their time, research, and data in a community effort to improve population health and access. I admit this openness perspective among the public health research community was quite different from my previous experiences with hard sciences and information sharing. I was able to build upon my epidemiologic skills in an ongoing outbreak scenario, improve my diplomatic skills during communication with Ministry of Health agencies around the world, and expand my working knowledge of public health terminology. My experience afforded me with the ability to establish groundwork and networking that allow me to better communicate with others in the infectious disease space. I've also become a contact for many state and local health agencies to support their efforts to educate providers. The experience helped to facilitate recognition of my own personal growth in terms of communication skills and to outline areas of improvement I must address, such as creating budgets and timelines for implementation of the Preparedness and Response Plan work product. In assessing my areas of improvement as they relate to my career goals, I recognize that I am interested in pursuing education within the Masters of Business Administration space. For employment opportunities, I recognize my interest in pursuit of career opportunities within the CDC and WHO. I also wish to explore public health opportunities outside of my current location, potentially elsewhere in the United States or internationally. I wish to thank Eastern Washington University and the Master of Public Health graduate program and those professors. My time learning from you and other students will be one I cherish and reflect back upon regularly. Thank you for your time.